If you're tired of hiding your body inside baggy clothes, I believe it's time to take action. And the tummy tuck with liposuction is a wonderful surgery for correcting your middle areas of the body and getting a perfect toned abdomen that you had always aspired for. I'm Dr. Srinjay Saha, a consultant plastic surgeon and a clinical associate professor at Apollo Hospital, Kolkata, and I'll be talking about how it can make a difference in your life. While doing a tummy tuck, we make cuts in the hidden areas of the body, and what we mean by the hidden areas is that it's between the abdomen and the pubis. It's just the area which is underneath your panty lines, so that even if you go later on into a beach, nobody would be able to notice because the scar would be hidden deep inside. And what we do is we take out excess part of the abdominal skin and muscles through that incision. And that's a cut in medical terms. And we throw out the excess part of the skin and fat. And then we strengthen the muscles, and then we cut out the excess part of the abdomen, and then we shape and drape the abdomen into the shape that you wanted. Let me put this in a perspective. If you think of a sculptor with a slab of stone and carving out a perfectly toned human body, like Michelangelo with David, you'd have to think a plastic surgeon is doing the same with your body. They're seeing what you are, and then they're imagining what it would be after the surgery from their own experiences. And then they would be doing a cut, a stitch, and they would be taking out fat through liposuction in order to chisel your body and sculpt your body into a perfect shape, which becomes manifest not immediately but after a few months. But when it does, it is what you had always aspired for. So it's not just about doing what we are doing right now, but also imagining and getting that shape in the future. This is the beauty of plastic surgery, which none of the other surgical specialties share. It's about getting something which is normal into something which is supranormal. While doing this, I believe the most important thing during this surgery is to strengthen the muscles. And this is especially true for women who had been through pregnancies, double pregnancies more than the single ones, and that is when the abdominal muscles become loose and lax, and what we do is we repair that and we get that into a perfect and a firm shape, and then we just redrape the skin like a masterful sculptor would be resculpting the slab of stone. Along with it, we prefer to do some liposuction, and what we mean by liposuction is that we are sucking out excess fat from deep inside the body in areas which are resistant to diet and exercise. So if you had been into diet and exercise regimen and you found that nothing is working, only your abdomen is becoming loose and saggy, this liposuction combined with a tummy tuck would really work wonders. It also has some benefits. If there are some people with umbilical hernia, we can repair the hernia at the same time. If people have incontinence, it has been found that a tummy tuck improves urinary incontinence, especially in middle-aged ladies. And obviously, while we are taking it out, it has been seen in some, not in all, that if people have insulin resistance, they benefit from this surgery as well.